Moving to next one. Still joints problems. Yeah, arthritis. So arthritis by Western medicine. Yeah, by Western medicine. They may cause by different reasons. This is a special kind of arthritis. But by Western medicine, they may have some others. So these arthritis, the cause reasons by Western medicine, mainly by the autoimmunity disorder. So that's why we separate talking about this arthritis. So these still chronic kind of problems. And still relationship with joints, some joints pain, but usually go to small joints. It's not a big joints problem. And some inflammation in there, and possible most case happens on both sides of the body. So that's basically we say for West medicine belong to autoimmunity disorder. When we're talking about autoimmunity disorder, mostly we say etiology reason is not that clear. Why people cause that autoimmunity disorder? So autoimmunity illness we're talking about before. Basically, people's immunity system will against their own cells and tissues, and then cause problems. It's usually it's not common for the people. But what's the trigger that happens is not clear. So that's basically some doctors thinking about that maybe something relationship with the food allergy or maybe relationship with genetic reasons or maybe this lifestyle and even relationship with some like virus infections or bacterial infections, but still not that totally clear. Symptoms. So these illness symptoms pretty similar like last one, but still something different. So the first symptoms and the signs is some inflammation in the joints, especially in the small joints. So could be small joints of the feet and maybe small joints on the head, and also including the elbows, ankles, but mainly affected of small joints. And more tender from the beginning. It's not a severe pain there. It's more tender. And still have stiffness. Still like stiffness about 30 minutes. And then getting better. So that's basically happens in the morning time, after sleep, or even sometimes like people not moving, not moving their fingers, then they feel stiffness. And then the situation continually, if not cured, then got deformed. And maybe we can find some nodules around the joint. And a possible patient with fever. If they have fever, the usually is low degree kind of fever. It's not high fever. So basically, it's joint pain is not that severe, but stiffness and then deformed. So Western medicine diagnosis for this illness, like we talking about a lot of problems relationship with joints and the joint pain conditions. So that's for Western medicine, they always try to go to laboratory tests to find what's the trouble in there. Truly, we have something can get some suggestions, but not 100% like truly get diagnosis. So still later on, when the illness getting severe, and then X-ray check, truly can saw the joints get some changing, like the space narrow and some damage in the joints. Western medicine treatment for this illness, so can combination with some anti-inflammation kind of medications. We have two different categories by their chemicals, yeah, by their chemical structures. And we also can use some other medication decrease our immunity function. So that's basically. And the severe case, yeah, severe case maybe still need surgery. So that's basically Western medicine treatment. Then we still move into TCM. So TCM relationship still joint pain. We still mainly go to B syndrome. So basically the same, yeah, basically the same with last year. But truly for some people, they may more tired or fatigue. That's maybe we give the other name, 疲倦. This means fatigue. And also patient maybe have low degree kind of fever, which is a 发热. 热 is heat, yeah, 发 is generate some heat. So that's we may give some other names. But mainly symptoms still joint pain, still B syndrome or B 症. So cause for the illness, still combination, external reason, passenger evading, and especially people long-term living in pretty damp kind of environments, or maybe catching some wind, cold, dampness, or even heat evils. That's still the main reason for TTM. Then we still go to different patterns. The first pattern, wind, cold, dampness, we put together. So that's basically from beginning stage. Thus, maybe one joint or maybe multiple joints, swollen and painful. And it's more effective like getting pain, getting cold condition. And the local area is cold feeling. And still have early morning stiffness and maybe heavy sensation because some combination, some dumbness and maybe numbness and limited kind of movement of the joints. When getting cold, painful worse. When getting heat, it feels better. And truly, it changing by the weather. Like a better weather warm, it's getting better. The weather cold is more severe painful. Other symptoms, other symptoms. It's possible aversion to cold and losing stool and clear big amount urination or maybe fever chill at the same time. And pretty possible patient have severe cut pain in the joint. Tongue usually pale tongue and the tongue coating is a thin white coating. The pulse, the pulse usually is deeper or maybe very or tight. So basically, if cold go to deeper part of body and blocking there. So treatment principle, we're still thinking about its relationship with the external wind. So dispersing wind and dampness and warming the channels and stopping. The formula we use 温经卷壁汤. Wenjing warm the channels and relieve B syndrome. I don't think this formula in OCTGM list. So that's basically like working for these kind of conditions. Still warming herbs inside, and especially warming the channels. Acupuncture treatment, this condition you still can use massage. Cold condition, you still can use massage. But acupuncture, we still can go to wind points, gallbladder 20, and we also have bladder 12, also wind points. And bladder 17, moving blood, moving blood. Bladder 23, kidney 25, and 人4, T blood 25. So basically, we're still talking about passenger evading because internally body 正地 deficiency and plus local points. Then we go to the pattern, wind damp heat pattern. Wind damp heat pattern usually is acute stage kind of arthritis. So local joints swollen, painful, and sometimes redness and heavy sensation, movement limited. So local area is burning kind of sensation. And if we touching it, it's hot. And we say redness. And the cold make it better. Cold make it better. That's the heat condition. Other symptoms, some heat, yes, some heat symptoms, fever, sweating, and possible some redness, urination. So basically, these autoimmunity disorder, they can attacking internal organ also, not only the joint. So can cause the blood in the urine. And the right tongue, yellow tongue coating. So that's internal heat tongue. Sleepy pulse is kind of dampness pulse. Rapid pulse is the heat. Soggy, the same like a softer. Rapid, still dampness is the heat. Treatment principle, clear heat, relieve dampness, and still dispersing wind. We say wind carry other passengers go in. 白虎加桂枝汤加味。So basic formula is 白虎汤。白虎汤 we say that's clear heat condition formula. Clear internal heat. 桂枝 is warming herb actually. 桂枝汤 we are pretty commonly used for the condition wind like a EPI evading wind cold condition. But because we have like a 石膏 in the 白虎汤, clear heat herbs in there, so we can combination with 桂枝 together. So that's basically 桂枝 especially go to the channel, open the channel. So that's why we use 白虎加桂枝汤店. So that's still clear heat, yeah, still clear heat, and remove dampness and open the channels. So these conditions we are not truly use maxa, but we can use acupuncture. Acupuncture we still use clear heat points to 14 Li11 clear internal heat. I4 still moving T over the channels. And 3焦5 helping Li4 together moving the T. And plus some local points. So still joints problems, but this one more go to small joints. Like a small joints in the hand, we can go to 八斜 acupoints. So that's basically we have 4 points on each hand. Together is 8 points. 八 is 8. That's called 八斜. And on the feet, we go to 八风. 斜 is passenger evil. 风 is wind. So that's from the point's name we know is relieve passenger evils or passenger wind. So that's basically in the pretty similar location on the toe, but just on the feet. That's 八风. So small joints. And the other joints, you can just around the joints and pick up some points there. Then we're talking about the pattern. So long-term problems generate heat, and the heat damages the yin. So that's a chronic problem. And the combination excessive condition with deficiency conditions. So still joints running, swollen, heat, and painful, and limited movement in there, and better with cold conditions. But it's long-term problem, not cured. Then damaging, then cause some dry mouth, sometimes maybe bitter taste in the mouth, and cause internal heat, maybe patient insomnia, and vexation, and irritability, red tongue, yellow tongue coating, and rapid pulse. Thin or thin pulse means some deficiency damage in already. So treatment principle will eliminate dampness and clear heat. So we use the formula 桂枝芍药知母汤. So 桂枝 still go to the channels, circulation qi in the channels. 芍药 is blood nourishing herb, nourishing blood, nourishing yin. 知母 is clear heat. So that's combination. Clear heat, open channels, and nourishing the blood. Certainly, they have other ingredients inside. And this pattern we still not use moxibustion. That's still heat in there. We still use some points like a clear heat. You're still adding like a 214 there. And some points moving key, and reinforce still 25 points, and also plus local points. Then we go to pattern, we're talking about the T blood both difference and phlegm stagnation, and even maybe blood stagnation. So mixed pattern, more complicated. So that's basically in the later stage of the EOE. And the joints pretty stiffness and deformed and painful, swollen, movement limited, and patient may have also internal organs disorder like palpitation, short breath, fatigue, and the patient's pulse pretty deeper and pretty weaker usually. So that's basically it's a little bit more severe kind of conditions. So certainly we need 25 T, 25 blood, and the result from and moving stasis. So if the patient mainly show up is more cold condition, we use 黄芪桂枝五物汤. So that's 出来 25 T and warming the channel formula. If patient's mainly symptoms relationship with wind dampness heat in there, so we can use the formula 当归免痛汤. I'm sure 黄芪桂枝五物汤 in our CTCM list. double check this one. Originally not in CTCM list, but last year they adding lot of new formula in there. So I'm not sure this one if they are in there or not in there. So that's checking for this one. Acupuncture. Acupuncture treatment. Cold pattern we still can use massage. Heat pattern we are not use for massage for the same ruler. And mainly is 25 points there plus local points. Then we're talking about the pattern. Liver blood deficiency, kidney yin and yang deficiency, with phlegm, with stasis, blood stasis. So still later stage, severe case, and the joint pain, stiffness, and disformed. And also patient may have some other symptoms relationship with internal organs, like we're talking about other illness, dizziness, tinnitus, frequent urination, night urination, lower back pain, and the pulse still pretty weak. Usually is slow, especially in chi position. Chi position is the kidney position. So that's the mainly kidney deficiency, both yin and yang deficiency. So treatment principle, we need mainly tonified kidney, tonified kidney yin and yang, and nourishing the liver. So we're still talking about mother and son's relationship. We use 肾气丸加味 plus. We have 金匮肾气丸 mainly kidney yang tonified. We have 六味地黄丸 mainly kidney yin tonified. To see patient's conditions to suitable for which formula, but both belong to 肾气丸. And acupuncture. So if more yang deficiency, we still can mark the function. If yin deficiency, we need to see if severe heat in there, we are not use massage. But truly, we can use lot of points to nourishing and tonify. You can plus more. You know lot of points already. And plus local points. So generally speaking, so if patient like got this illness, generally say it's chronic long-term disorder, it's difficult to treat. Yeah, difficult to treat. We need thinking about the patterns, but usually relationship with the liver, like liver qi stagnations. So that we need soothing the liver, moving the qi. And if patient have wind condition, we need dispersing the wind. And also for not only for this illness, also for others belong to autoimmunity disorder. Like the patient food need very be careful. So some food may be trigger the problem and make the problem is more worse. And also we still need a regular middle gel. So middle gel shu and jie functions and moving everything. So some pattern have like phlegm. So we need stronger the middle gel and moving the phlegm, so that most patients maybe have spleen T deficiency kind of disorder. So that's for these illness.